A very warm welcome to all my friends. Today's topic is breastfeeding. We'll be discussing the breastfeeding, its importance, benefits, physiology of lactation, and anatomy of breast, and what the various proper techniques in breastfeeding. Now let's see. Breast milk is considered as the ideal food for neonates and infants up to 6 months of age. Breastfeeding or nursing is the normal way of providing infants with optimum nutrition for healthy growth and development. WHO and UNICEF recommend early initiation of breastfeeding within 1 hour of birth, exclusive breastfeeding for the first 6 months of life, introduction of nutritionally adequate, safe, complementary foods at 6 months, together with continuous breastfeeding up to 2 years of age. Implementation and monitoring of comprehensive implementation plan on maternal, infant and young child nutrition endorsed by the member states in May 2012. The plan includes 6 targets, one of which is to increase by 2025 the rate of exclusive breastfeeding for the first 6 months up to at least 50%. For newborns, every minute counts. 1 hour is optimal after birth, where we should start feeding the child. Risk of infection and death increase if there is a delay in initiation of breastfeeding. Breastfeeding less than 1 hour after birth saves lives and provides benefits that last lifetime. The longer the babies need to wait, the greater they are at risk. Waiting for 2 to 23 hours increases the risk of death by 1.3 times. Breast crawling. Every newborn, when placed on her mother's abdomen soon after birth, has the ability to find her mother's breast all on her own and to decide when to take the first breastfeed. This is called the breast crawl. The components involved in the crawl are the sensory input from the mother, the visual olfactory input of the child, baby, the taste auditory input and a touch. The global scenario, a new report released in 2017 by UNICEF and WHO has ranked Sri Lanka at the top of the list of countries with early initiation of breastfeeding. Deaths of an estimated 8,20,000 children under 5 years could be prevented globally every year with increased breastfeeding. Only 2 in 5 newborns are breastfed within the first hour of life across the world. As you see here, globally only 2 out of 5 newborns are put to breast within the first 2 hours of life. And you find that in Asia, Southeast Asia, it's only 40% women who are able to achieve that. India ranks 56. At the top is Sri Lanka, followed by Vanuatu, Burundi, Kazakhstan, Kyrgyzstan, Samoa, etc. And the global scenario is most of the world's newborns are left waiting for too long to start breastfeeding. In 2017, an estimated 78 million newborns across the world had to wait for more than 1 hour to be put on breastfeeding. This means that only 2 in 5 children were put on breast within the first hour of life. India ranks 56th among the 76 countries that were analyzed. Only 6% mothers in India are okay with public breastfeeding pieces. Uttar Pradesh, Delhi, Rajasthan, Uttarakhand and Punjab fare the worst when it comes to the practice of breastfeeding according to the report card released by the Union Health Ministry. The Andhra Pradesh state ranks 29th in the nation in breastfeeding. Bhopal is the second bottom ranker with only 18% infants are fed within 1 hour. Chennai is at top. Trends of breastfeeding in India. The key indicators which were used in NFHS 3 and 4 are children under 3 years of age breastfed within 1 hour of birth has increased from 23% in NFHS 3 to 41% in NFHS 4. Children under 6 months exclusively breastfed have increased from 46% to 54.9%. Children aged 6 to 8 months receiving solid or semi-solid food and breast milk has declined from 52% to 42%. So these are some of the statistics which are available from our Indian Family Health Surveys. Now why we are insisting so much on breastfeeding? What is the importance of breastfeeding? Breastfeeding is a cornerstone of child survival. It is the first vaccine which we can give to the newborn. Poor breastfeeding practices contribute 20% to the neonatal deaths, and 13% of the deaths are below 5 years of age. 20,000 mothers die. Deaths due to breast and ovarian cancer can be averted. For India, breastfeeding can reduce 1,50,000 children, 56 children, 1,56,000 children every year. They reduce the diarrheal episodes and reduce over 3.4 million episodes of respiratory infections and 3.9 million of diarrhea. So the early breastfeeding improves infant mortality. As we can see in this bar diagram, uh, as the infant mortality has been showing a decline from the year 1992 to 2015, and at the same time there is increase in the number of children who are breastfed within 1 hour of birth, which was very low in 1992-93 and has steadily increased now to 41%. So there is a direct relationship between the infant mortality and breastfeeding within 1 hour. Now, what are the benefits of breastfeeding? Nutritional superiority. Breast milk contains all the nutrients in optimal proportions for growth and development. It contains high concentration of lactose, 6 to 7 grams per deciliter. It helps in absorption of calcium and it enhances the growth of lactobacilli, that is the good bacteria. So these are the, as we all know that breast milk is a complete food for the child, complete food for the small baby. It contains optimally everything in the right proportion, in the right form, easier to digest, easier to absorb. It contains high concentration of lactose, that is 6 to 7%. It helps in absorbing calcium. It helps this lactose. Lactose helps in absorbing the calcium, and there are a lot of lactobacilli also present. Then it contains a lower protein content as compared to cow milk or the buffalo milk, but the quality is much better. Cysteine and taurine are present for neurotransmission and neuromodulation. Fats, it is rich in PUFA, which is required for the myelination of the nervous system. Then immunological superiority. Secretory IgA, macrophages, lymphocytes and lysozymes are present in the breast milk. The secretory IgA act as protection for the baby, and that's why breastfeeding is called as the first immunization of the child. A breastfed baby is 14 times less likely to die from diarrhea and 4 times less likely to die from respiratory infection. Immunologically, breast milk is superior because it contains secretory IgA, macrophages, lymphocytes, lysozymes. A breastfed baby is 14 times likely to die from diarrhea and 4 times less likely to die from respiratory infection. It prevents allergies, ear infections, orthodontic problems, diabetes and high heart disease. It also contains high amount of water and electrolytes. What are the advantages in mental growth? There is seen that those who are breastfed, the breastfed babies have 8 points higher IQ than the non-breastfed babies. Other benefits: it protects from obesity, protects from neonatal hypocalcemia and hypomagnesemia, and it promotes bonding between the mother and the infant. For the mother, what are the benefits? It helps in uterine involution. The uterus, which has become a very big and it has expanded to accommodate the baby, there is involution of the uterus after delivery, and breastfeeding, the oxytocin hormone that is released helps in uterine involution. It reduces the chance of postpartum hemorrhage. It causes lactational amenorrhea and protects the mother from subsequent pregnancies, at least in the initial 6 to 12 weeks. It reduces the risk of breast and ovarian cancer, and an effective way of shedding extra weight which the mother has gained during pregnancy. Now let's see the the physiology. How is the milk produced? There are 5 stages. Mammogenesis, development of breast into functional state. Lactogenesis, synthesis and secretion of milk from the breast alveoli. Galactokinesis, ejection of milk outside the breast. Galactopoiesis, maintenance of lactation. And involution, that is a regression and atrophy post breastfeeding. So there are the 5 stages: milk production and secretion. Lactogenesis is the onset of milk secretion and includes all of the changes in the mammary epithelium necessary to go from undifferentiated mammary gland in early pregnancy to full lactational activated gland during the sometimes after parturition. The prolactin reflex, that is a milk secretion reflex. Prolactin, which is produced by the anterior pituitary gland, is responsible for milk secretion by the alveolar epithelial cells. Prolactin reflex. Prolactin in blood. The baby is sucking. These are sensory inputs from the nipple which reach the brain of the mother. More prolactin would be secreted. That's secreted after feed to produce the next feed. Oxytocin is the milk ejection reflex. While prolactin is important for the production of milk, oxytocin is important for the ejection of milk from the breast. Oxytocin is a hormone produced by the posterior pituitary. It is responsible for the ejection of milk from the glands into the lactiferous sinuses. Since this reflex is affected by the mother's emotions, a relaxed, confident attitude helps the milk ejection reflex. On the other hand, tension and lack of confidence hinder the milk flow. Oxytocin causes the contraction of the myoepithelial cells in the breast, and thus it causes the let down. The sensory reflexes impulses reach the brain through the nipple. Now let's for one slide see the anatomy of breast is shown in the picture. It contains of numerous glands. It's a modified sweat glands. The alveoli are present which produce the breast milk, and these are the milk secreting cells lining the alveoli. And there are then the ducts, and these ducts they reach the lactiferous sinus, and from the lactiferous sinus is present underneath the areola, that is the dark part of the nipple, and from there the lactiferous sinuses they they come together and they are produce the nipple. So this is how the breast looks anatomically. Now, what does the baby have? Baby is gifted with a rooting reflex. Whenever you touch the cheek or the side of the mouth of the baby, he or she will open her mouth. So if you touch the angle of the mouth of the baby with a slight even tactile stimulation, he will open the mouth, and this helps the baby find a nipple in order for proper attachment to the breast. So the suckling reflex, drawing the nipple and areola to form an elongated teat inside the mouth, pressing the stretched nipple and areola with the jaw and the tongue against the palate. This is how the baby actually sucks the milk. If the baby is able to suck and swallow properly, then the 9, 10 and 11 cranial nerves are intact. Swallowing reflex. When the mouth is filled with milk, the baby reflexly swallows the milk. It requires a couple of suckles before the baby can get enough milk to trigger swallowing reflex. It requires coordination with breathing. So the suck, swallow, breathe cycle lasts for about 1 second. Breast milk composition. Under normal condition, Indian mothers secrete 450 to 600 ml of milk daily with 1.1 gram protein per 100 ml. The energy content in the breast milk is 70 kilocalorie per 100 ml. Composition of breast milk. It contains fats 4% for the development of brain and the nervous system and eyes. It contains 7% carbohydrates, mainly the lactose, which benefits the gut microbiome flora, and it also aids the calcium absorption. It contains 1% protein, which is essential for as a building block for growth and development, and it contains 0.2% vitamins and minerals, and rest 86 to 88% is the water. So it contains less amount of proteins as compared to the uh, cow milk, and a more amount of fat. Now we will see what are the different types of breast milk. According to the gestational age, we have the preterm milk and the term milk. According to the stage of lactation, we have the colostrum, transitional milk and mature milk. And according to the feed, we have the fore milk and the hind milk. So these are the types of breast milk. According to the gestational age, the preterm milk, if the baby has given, the mother has given birth to a preterm baby, she will produce the preterm milk, and it will contain more protein, sodium, iron, immunoglobulin as per the requirements of the preterm baby. The term milk is a milk secreted by the baby delivered after 37 weeks. High calcium content is present in the term milk as compared to the preterm milk. Then colostrum, or it's also called as bee sting or first milk. It's a thick yellowish colored liquid, and it is produced in small quantity as compared to breast milk. It is 10 to 40 ml and it's thicker, and high carbohydrates, proteins, antibodies, but low in fats. Colostrum acts as the first vaccine for the child. It is rich in antibodies, so produces protection against infection. Then it acts as a purgative, which clears meconium, helps prevent jaundice. Growth factor, maturation of intestines and prevents allergy. Then vitamin A rich food, protects against diarrhea, measles and vitamin A related eye diseases. So this is the advantage of colostrum. It is protecting against infection. It acts as a purgative. helps prevent jaundice, maturation of intestine. Then after colostrum, what is produced? A transitional milk, which is secreted after 3 to 4 days until 2 weeks. Again, immunoglobulin and protein content decreases while fat and sugar content increases. Then mature milk, thinner and watery but contains all nutrients. According to the time of the feed, you can have fore milk or hind milk. Fore milk is the earlier part in the initial session of the breastfeeding. The initial milk that is produced is called fore milk. It is produced at the beginning of the feed. It satisfies the baby's thirst and it is rich in lactose, protein and water. While the hind milk, which is produced at the end of the feed, is more of rich in fat and it gives a lot of energy. Now, how much should be the duration and the frequency of the breastfeeding session? So it depends and it varies from the mother to mother and child to child. Generally, the duration is minimum 15 to 20 minutes. It can be as long as 40 minutes or 1 hour, but depends per case. And the frequency of feeding is usually 8 to 10 times in a day. Generally, the child baby demands or the newborn demands a 2 hourly breastfeed, and also the mother should remember to breastfeed at night feeds. Since more prolactin is produced in mothers during night time, breastfeeding is very important during night for maintaining the reflex. Sufficient feeding in babies. Frequent feeding 8 to 10 times a day, audible and visible swallowing, sustained rhythmic suck, average daily weight gain of 20 to 40 grams, relaxed arms and heads, moist mouth, goes to sleep and gets comfortable after the sleep. So these are the indicators of breastfeeding. So what are the indicators for sufficient feeding in babies? Babies have to be fed frequently, at least 8 to 10 times in a day with the audible, visible swallowing, and has to be an average daily weight gain of 20 to 40 grams per day. With the baby should sleep very relaxed after breastfeeding. Introduction of complementary feeding, gradual process which starts around the age of 6 months because the mother's milk is not sufficient to sustain the growth of baby after 6 months. Complementary foods which can be used or which are introduced to the baby's diet include mashed potato, suji, porridge, soup or soft fruits. Now we'll see what's expressed breast milk. If mother is not in a position to feed her baby, she should express her milk in a clean, wide mouth container, and this milk should be fed to the baby. Express breast milk can be stored at room temperature for 6 to 8 hours and in a refrigerator for 24 hours and in the freezer at minus 20 degrees for 3 months. Now, what are the proper techniques for breastfeeding? First, you have to be very careful while we position the baby. The baby's whole body is supported with the help of the arm of the mother, and not just the neck or shoulder, but her baby's head, neck, and the back. They should all lie in a single line and well supported with the arm or pillow. Baby's head and body are in one line without any twist in the neck. Baby's body is turned towards the mother's body and baby's nose is at the level of the nipple. So these are the various positions: cradle position, cross cradle and back lying, football. The mother can feed the baby in the lying down position if she is comfortable. What are the signs of good attachment? The baby's mouth should be wide open. with most of the nipple and the areola in the mouth, and only the upper part of areola should be visible. The baby's lower lip is to be everted and the chin should touch the breast. So these are the signs of food attachment. Now the mother has to take care that the baby doesn't just latch on to the nipple, but it also puts the maximum part of the areola inside her or his mouth, so that the lactiferous glands are compressed and it helps in the ejection of milk. The baby should suck slowly and pause in between to swallow the milk. The baby also takes a pause in order to breathe air. Ineffective suckling, infant suckle for a short time but tires out and is unable to feed for long. We have seen the various position for the baby and the mother. The mother should be positioned or should be sitting comfortably in her room and should be given privacy, and she should be also given back support and the arms should be supported with the help of the pillows. Now let's see what are the problems during breastfeeding. The first one is a sore or a cracked nipple. In order to prevent this problem, mother should ensure that the baby is properly latched and the position of the mother and the baby is correct. What is the treatment? Is it the mother can apply hind milk on the affected area, and there are also commercial products like nip care cream are available. Breast engorgement. Breast engorgement is when the breast get too full of milk. The baby is not feeding and has not fed for a long time, for 4 to 5 hours or more than 6 hours. Then it results in the engorgement of the breast and the breast becomes too hard and tight and painful, and the baby can't latch properly because the nipple becomes too firm. How to prevent engorgement is through early and frequent feeds. How to relieve engorgement? Mother can manually remove the excess milk from the breast by either hand using expressing the she can remove the milk manually or she can use a breast pump. Analgesics can be given for relief of pain. Hot compressions can be done. She can use a hot towel or a hot water bottle in order to slightly massage the breasts, and then she can slowly and manually remove the milk from the breasts. The third problem which is frequently found is the blocked milk duct. Sometimes the milk can get blocked and it can result in the formation of a lump which is hard and painful. So treatment is again applying a warm cloth or a warm napkin, removing the milk from the blocked area and changing the breastfeeding position so that the baby's chin or nose points towards the clogged duct, making it easier for the removal of the obstacle. Then mastitis. Mastitis is inflammation of the skin and inflammation of the glands of the lactiferous glands, the alveoli. We can have to give antibiotics and analgesic, and sometimes it becomes very painful. Sometimes it leads to the formation of an abscess. In that case, the abscess needs to be drained and treated with antibiotics. Then the other frequently observed problem is the inverted or flat nipple. The treatment should be started. Ideally, it should be identified before the delivery during the antenatal visits of the mother. And if we find that the mother is having flat nipple, it has to be everted manually or with the help of a syringe. So what we can do is we can cut the syringe, the narrow part, and just broaden the syringe mouth, and then with the help of the pump and the syringe it will help us to evert the inverted nipple. And breast abscess can occur because there's a delayed treatment of the sore nipple or other such mastitis can complicate into a breast abscess. The abscess needs to be drained and given systemic antibiotics. The seventh problem which we can encounter is the not enough milk. This can be because of the incorrect method of breastfeeding, the supplementary or the bottle feeding. There are no night breastfeeding, engorgement, any illness, painful condition, the mother is under a lot of stress, or she has got insufficient sleep. So these are the various reasons which can lead to the mother not producing enough milk. For this, the mother should be advised sufficiently. She should be given sufficient rest, and she should be asked to drink lot amount of liquids, at least 2 to 3 liters of water per day. Then she should be given relaxation. She should be counseled to have and her confidence should be boosted, and she should be asked to feed the baby on time and take the long duration of feed. Then sometimes we see this breastfeeding and thrush. Thrush is a yeast infection, which is the infection of the tongue and the mouth, and common infection which can be transmitted from mother to the baby during breastfeeding. That can be taken care of by applying antifungal cream or paints. Then lactose intolerance. Infant should finish suckling the first breast to try to get more of the fatty milk. Fat in the milk slows the digestion, so more lactose is broken down and absorbed. Less than 55% of the newborns are exclusively breastfed in India. Only 54.9% under the children under age 6 months have been exclusively breastfed according to the NFHS Survey 4. Now, let's see why. Why is this? When in our country, traditionally, it is we have all the traditions for breastfeeding, yet many people or mother are not able to exclusively feed their child with the breast milk. That is because a lack of interest in breastfeeding, there might be certain wrong beliefs, increasing in the number of working mothers. There are sometimes she is not able to get maternity leave and aping the Western countries, changing lifestyle, availability of alternatives to mother's milk, no specified zones in public spaces for breastfeeding, and the lack of family support and guidance. So these may be the reasons why the mothers are not able to exclusively breastfeed their children. In order to increase the awareness among the mothers and their families regarding breastfeeding, the WBW World Breastfeeding Week is celebrated every year. Every year in the first week of August, that is from 1st to 7th August. There is a World Alliance for Breastfeeding Action as a global network of individuals and organizations dedicated to the protection, promotion and support of breastfeeding worldwide. Then we come to the MA, that is the National Breastfeeding Program. Mother's Absolute Affection is a nationwide program for promoting breastfeeding and was launched by the Honorable Union Minister of Health and Family Welfare on 5th of August 2016. The components of this program are interpersonal counseling at community level, skilled support for breastfeeding at delivery points, awareness generation, promotion of breastfeeding, monitoring and recognition. Now we will see the BFHI or the Baby Friendly Hospital Initiative. BFHI was launched by WHO UNICEF in the year 1991. Since the launch, BFHI has grown with more than 152 countries around the world implementing this initiative. The BFHI was started in the year 1993 in India, and BFHI is progressing in the country. Around 1300 hospitals have been declared as baby friendly. The Infant Milk Substitutes, Infant Foods and Feeding Bottles Regulation of Production, Supply, Distribution Act, INS Act, was passed in 1992. What are the 10 steps to successful breastfeeding in the hospital? So these are the steps for the BFHI. Have a written breastfeeding policy that is routinely communicated to all the healthcare staff. All the doctors, nurses, paramedical workers should have knowledge about this policy. Train all the healthcare staff in skills necessary to implement the policy. Inform all pregnant women about the benefits and the management of breastfeeding. So all the mothers who are pregnant and have been getting delivered at the hospital should be given proper knowledge about breastfeeding, its advantages and how to manage breastfeeding. Help mothers initiate breastfeeding within 1 hour of birth. Show mothers how to breastfeed and how to maintain lactation, even if they should be separated, even if they are separated from the infants, they can continue with the breastfeeding and lactation. Give newborn infants no food or drink. No prelactials are allowed. No giving honey, tea, gold or anything else for in the initial stage or to be avoided unless medically indicated. Practice rooming in, that is, allowing mothers and infants to remain together in the same room 24 hours a day. So the infants are not to be separated from the mothers and kept in cribs, but they are to be kept along with the mothers. Encourage breastfeeding on demand. Give no artificial tits or pacifiers to the baby. Then foster the establishment of breastfeeding support group and refer mother to them on discharge from the hospital or clinic. So these are the 10 points of BFHI. IMS Act 1992, controlling the market and promotional activities of baby food manufacturers. They are no longer allowed to promote their baby products or the milk substitutes in a commercial. They are not allowed to advertise it by ensuring the proper use of breast milk substitutes. No advertisements, no free samples, no free or subsidized IMS educational material to any person, and no financial assistance of any kind. Now let's see breastfeeding in certain special conditions, like if the mother is HIV positive, if the mother is having active pulmonary tuberculosis, and in working mothers. So first we'll discuss HIV. Contraindications of breastfeeding are HIV, HTLV1 and 2, inborn errors of metabolism like galactosemia or phenylketonuria, untreated cases of TB, herpes lesions on mother's breast, mothers of certain medications like anti-cancer drugs and radioactive isotopes. With increased burden of HIV and TB, India cannot afford to contraindicate the breastfeeding to the mother babies with HIV positive mothers. So, is there any relation between breastfeeding and risk of transmission? Does ART have any role to decrease the transmission? So ARV intervention, if the mother is not taking ARV, antiretroviral treatment, and she is breastfeeding, the risk of transmission is 30 to 45%. There is no ARV and the mother is not breastfeeding, still there are 20 to 25% chance of transmission from mother to child during delivery or transplacentally. If the mother is on 3 drug ARV or antiretroviral therapy and she is breastfeeding, the chance is 2%. And if she is on 3 drug ART and not breastfeeding, the chance is 1%. So as we see, very minute difference if the mother is fully protected with the antiretroviral therapy. So what are the recommendations in HIV positive mothers? That they should initiate breastfeeding within 1 hour of delivery as the preferred option. Continue breastfeeding for at least 1 year for those with HIV negative status and 2 years for HIV positive status of children. ART should be started among all the pregnant women and mothers living with HIV, irrespective of their CD4 count and viral load. A FAST criteria is used to decide whether HIV positive mother can breastfeed or not, provided that she has not started the top feed yet. Once the mother starts to top feed the child, this criteria is not used. HIV positive mother in such case should continue top feed because mixed feed is more dangerous than top feed. So in India we recommend that mother should breastfeed the baby and under the cover of ART, and the mother should receive lifelong ART. And a FAST criteria is used when we want to decide whether the HIV positive mother can breastfeed or she should start on top feed. If she has already started, then we should not use the FAST criteria. If the mother has already started top feed, she should continue giving top feed to the baby so that and the mixed feeding should not be practiced. What is the full form of a fast? A is for acceptable. The mother perceives no problem in replacing the feed breast milk with the top milk. It is feasible. The mother has adequate time, knowledge, skills and resources and support to correctly mix formula of milk and feed the infant up to 12 times in 24 hours. Affordable. The mother and the family with the community and the health system support if necessary can pay the cost of replacement feeding without harming the health or the nutritional status of the family. Sustainable. Availability of a continuous supply of all the ingredients needed for safe replacement of feeding up to 1 year of age or longer. And safe. Replacement food are correctly and hygienically prepared and stored and fed properly while. So that was all about the mothers who had HIV positive mothers. The mother should not opt for the top feed if she does not fit into the AFAS criteria. Now let's see in case of tuberculosis. Continuous exclusive breastfeeding till 6 months of age and thereafter as in the normal population. Start ATT for mother immediately. Mother will be non-infective within 2 months of regular ATT. We can give the child preventive chemotherapy 10 mg per kg per day of isoniazid for the initial 6 months. Use face mask while around the baby till 2 months after starting the ATT. So if the tuberculosis is there and the mother is having tuberculosis, she should use face mask, cover her nose and mouth with the mask while she is around the baby, while she is breastfeeding the baby. And the baby can be given the chemoprophylaxis with isoniazid for the initial 6 months. And after the first 2 months of ATT, the mother is non-infective for the baby. BCG vaccine should be given at birth. Re-immunize with BCG after stopping the preventive chemotherapy. Remember, it's not only the mother. Anybody in the home who is having TB can infect the baby with tuberculosis. Is the ATT drug concentration in breast milk sufficient for the baby? Now the next case, special case, is the working mother. Working mothers usually prefer expressed breast milk. Number of times she has to feed is 12 times in the 24 hours till 6 months and then 5 to 6 times in 24 hours for the 6 months to 12 months. How long can we keep the expressed breast milk? How long can we store it? At room temperature for 8 to 10 hours, in the refrigerator for 24 hours and in the deep freezer for 3 months. Other conditions. Because some infants could not be fed by their mothers, early demise of mother or some chronic illness in the mother, humans have adopted substitute feeding, human breast milk bank, which is a recent advance, infant formula milk, and fortified human milk for premature infant. The Ministry of Health and Family Welfare launched the National Human Milk Bank at the Lady Hardinge Medical College, the first government-run human milk bank at present and the largest. Beneficiaries would be the babies who are premature, born below 32 weeks of gestation, and IUGR infants. Which are the drugs which are contraindicated for the mother in case she is breastfeeding? The mother should not be prescribed anti-cancer drugs, lithium, oral retinoids, iodine, amiodarone, and gold salts. Timing of the dose. Feeding the baby just before the mother takes the drug results in the baby receiving lowest possible drug dose. She should not be given cephalexin, galactogogues, medications that help in initiating and maintaining adequate milk production. Metoclopramide remains the drug of choice due to its documented record of efficacy and safety in infants. So that was all about breastfeeding, the anatomy and the physiology of breast, the various reflexes which are useful for breastfeeding, and various proper technique of breastfeeding and the various ways which it can be done, and what are the alternative criteria, alternative options available in case the mother is not able to feed the child. Thank you.